Thanks so much. Hi, I am Amy Harrington. I'm from the Kentucky Rural Health Association. I am the equity coordinator. I have met with you before in my role with public health in the vaccination department. So I left public health on October 4th and began with KRHA on October 7th. So I'm going to let Jessie Sanders introduce herself.
Hi, everyone. I'm Jessie Sanders. I'm the program director for the Immunize Kentucky Coalition. We are a program with the Kentucky Rural Health Association. So I've been with the association for over 3 years now. And we're really happy to be able to be on this webinar today. And thank you for allowing us to provide some health equity resources.
Okay, I'm going to share my screen. Okay, can everybody see my screen? Okay, perfect. So let's talk about who the Kentucky Rural Health Association are. We are a nonprofit organization that works to educate providers and consumers on issues that impact rural Kentucky. Those are much different than what we're seeing in the urban communities, especially as we talk about access. And we work with private and public leaders to ensure healthcare access for rural Kentuckians. Within the Kentucky Rural Health Association, we have two programs. Hold on. The Immunize Kentucky Coalition, and you met Jessie today. Her role is to focus on promotion of vaccination for all Kentuckians, and the Kentucky Hepatitis Academic Mentorship Program. And there we focus on screening, testing, and treating hepatitis C. We know that we have increasing cases of hepatitis C in our rural communities as compared to our urban communities. And so practice guidelines indicate that adults should be tested as well as adolescents, children and adolescents, at least once before they turn 18. Okay, so let's talk about vaccine equity. Vaccine equity is when everyone, regardless of their socioeconomic status, race, and ethnicity, geographic location, or other determinants, so think about social determinants of health, has a fair and just opportunity to be vaccinated. So who benefits from vaccine equity? Well, people, the individuals that receive the vaccine have improved health outcomes and protection against diseases. Employers, because we have reduced cost from fewer employees mixing work for illness or trying to work while sick. That also includes our kiddos in our schools. And in thinking about children in our schools, you hate to tie it to an economic factor, but we know our school budgets are based on school attendance. And so we want our children to be in school. Additionally, in many of our communities, it's the children being in school that keeps them safe, keeps them fed, exercised, and make sure that they are learning so they can grow and mature like their peers. Society benefits from reduced spread of diseases prevented by vaccines, and that's it's actually called V as in Victor, P as in Paul, D as in dog, or vaccine preventable diseases. Increased community protection leads to healthier citizens and lower healthcare costs. So let's talk about the cost of a vaccine preventable disease. So if we look at surveillance costs for one child that has chicken pox, that has measles, that has polio, the range is an investigation and just tracking and trending exposures is about $406,000 with a range of 1,098 to 21,000, 21,644,770. So a huge range there based on where you have exposure. So I'll give you an example. In the spring of last year, there was a measles exposure at Disney on Ice. There was a measles exposure several years ago at Disneyland in California. And so one little sprinkle of a vaccine preventable disease can impact a huge population. For measles specifically, the estimated cost to contain a case of measles, including follow-up, was about $140,000. And the total cost to stop the spread of measles is approximately $266 million. So there are other costs associated with vaccine preventable disease. In the United States, nearly 4.1 million admissions occur because of preventable conditions, and those conditions could have been prevented by vaccination. And so that's $30.1 billion in healthcare costs, hospital costs. In the US, to treat those vaccine preventable diseases, an annual cost for really the four major vaccine preventable disease amongst adults is $26.5 billion. Also, vaccine preventable disease are associated with an increased cost of time off work, disability, insurance cost, and some of those non-healthcare, direct healthcare related costs, as you talk about really changing your life because of the illness. So let's talk about school required vaccines. So you work with lots of children from many socioeconomic and ethnic backgrounds. And so in our state of Kentucky, there are vaccines that are required in order to enroll in school. So where do you find those individuals that can provide vaccinations to our schools, children? I'm going to take this from a lens of health equity. So we're going to focus on those that may or may not have access to a pediatrician or be fully insured. So I've provided a link to the Kentucky Department of Public Health Vaccine for Children program. And so the link provides a list of every clinic, pharmacy in the state of Kentucky that provides free vaccines to those that are or underinsured. Okay. The other thing is that we've had some legislative changes that impact pharmacies. And so in the spring of last year, legislation was passed that allowed pharmacies to vaccinate children down to the age of 5. So with that, we worked with our CVS's, our Kroger's, and our Walmarts and our Walgreens, because they have weekend and evening hours when many of our parents are working. Poor parents are off work to take their children for treatment. And so we worked with Medicaid in those clinics. So Medicaid now covers all Medicaid is a approved CVS, Kroger, Walgreens, and Walmart as a provider. So whether you have Aetna or Anthem or whatever type of Medicaid, you can go to any of these pharmacies that are listed on the screen to receive the vaccine. And then Medicaid will be billed directly for those. Now, if you have a patient that doesn't have Medicaid, then using the list that I provided for VFC, then they would be able to get the vaccine. And I think about those that aren't Medicaid eligible for some reason, and we need to consider our immigrant population. For those students that have insurance, they can also go to these exact same sites to receive the vaccine, and their insurance can be billed for those. If the child is interested in receiving, the parent's interested in the child receiving the COVID vaccine, pharmacists can vaccinate down to the age of 3. For all other vaccines, it's 5 and older. When I refer to Kroger, I also, please consider the little clinic. So if the child goes to Kroger and they're the younger age, then the Kroger pharmacy may send them to the little clinic, which is adjacent for those folks to get the vaccine. So this provides a great source for free as well as Medicaid billable vaccination in your private vaccines. Now, we want our kiddos to be healthy, and not only considering vaccination, but also we want every child to have a medical home. We want them to have physicals. And as we begin to look at our adolescent population, we want to make sure that those individuals are screened for depression and as well as stress and anxiety. In working with the little clinic at Kroger, if your patient doesn't have a primary care provider, we want every child to have a primary care provider. So in working with Kroger, at the Little Clinic, they will do the sports physical for a nominal cost, and they will do some of those anxiety screenings that we see our adolescent children needing. These are the Medicaid companies here in the state, and there are incentives that are offered based on different things that are done. So if you look under Passport, up to $140 in gift card credits for completing the following vaccines by the age of 2. $50 if the child gets an HPV vaccine. For your family members who may be expecting, here are prenatal and postpartum visits. They can also get a car seat or a booster seat. Many times we have problems with transportation to appointments under United Healthcare. They have 24 free one-way trips for community or medical services, so this takes care of that cost. If we talk about health and hygiene, these products can be shipped to their home if you look at WellCare. WellCare also offers transportation services. United has telehealth. So if they don't have internet, they can do that maybe at a school library or the public library. You see diapers and we see transportation. Passport are the incentives and the reimbursements for car seats. You look at Humana Healthy Living, they can earn up to $1,770 in rewards and added benefits, $720 in gift cards. They can get cribs, car seats, meals. And for this Humana meal, it is fresh vegetables, lean meats that are delivered to the postpartum mother's home, and doula services. There are also provide services to help with utility payments, haircuts, smartphones, fresh meals, Anthem, lots and lots of benefits. So this, I think, is a great tool as you work with your families to understand what resources are out there to help support them. Additionally, I provided a link for each of the MCO handbooks. And so a page number of where you can look at for different benefits as you work with your families to talk about not only access to vaccine, but food security, transportation, etc. Okay, so I'd like everybody to scan this QR code with your phone, or you can, if you have a second screen, go to menti.com and here's your code. I'll give you a few minutes to do that. Okay, I'm going to stop sharing this screen and I'm going to share my Menti screen. Okay. All right, now that you've logged in, answer this question. What challenges do your families face? And you can type in your responses. What types of challenges do your families face? Jesse, are you able to see the screen to type in a response?
I cannot type in a response, but I see it pulled up here. Let me see.
Did you log into menti.com?
Yes. Oh, someone just said it asked them a different question. Okay, let me see here.
Let me go back.
9483.
Here we go. Here we go.
Oh, perfect. Yes, that's what I got. That first question.
There we go. What challenges do your families face? Transportation, food, low income, financial, lots of financial questions. So I'm hopeful that that resource I provided where they can get incentives, up to $1,700 in money is helpful. We have about 22 participants on the call. I'm going to wait a minute or so longer and see. There we go.
17.
So as the bigger the word, the more people are responding to it. So that means lots of folks have identified transportation. So I'll make sure that I provide that tool to you because Medicaid will help provide transportation, cover transportation in order to get your folks to the doctor's appointments. Okay. So you're going to rate what types of resources are needed. Transportation, food, housing, medical resources, or others. Mm. All right. We've got about 6 responses. So interesting, on our word cloud, transportation was the largest challenge. But as we look at resources, we see housing resources. In many communities, the rent has increased significantly at our housing complexes. And so that poses a challenge for those individuals. Okay, I'm going to go move to the next slide. What community barriers impact the work that you do? So what challenges are you finding within your own community? You know what you're supposed to do, and you've tried everything you can to get whatever your client needs or to get your work done and make sure you all meet your grant objectives. But what community barriers are impacting the work that you do? Lack of resources. Anyone else? Not enough affordable housing, connecting families to the right resource, lack of availability, extensive wait lists, not meeting criteria, not many resources for utility assistance, not much housing availability, knowledge of programs and resources. And I'd love for you guys to come off mute. As you talk about resources, I know as an organization, you all have resources and reference manuals that have been created by the state kind of a standardized process to look for resources. And then in addition to that, you know your community, so you probably added some additional resources into that. Um, Tell us about the knowledge of program and resources. Is there, um, do you know they exist? You just can't find them? Is there a concern that those resources exist in your community? Um, what type of resources are we talking about? Um, because my next question is, how can we help? And so what type of resources can we establish? What type of support can we provide to do that? So would you guys mind coming off mute and sharing a little bit of more about knowledge of program and resources?
Um, I would like to say for my community, we do really well at making brochures and flyers, setting up bulletin boards, and in not just the schools, but in
Indi-
our mental behavioral health facilities, in our hospitals and stuff. And we like really partner well with Save the Children and other community action agencies. The problem is the demand not being so high that we can't get everyone what they need is the biggest issue we're having. Like
Demand
Daniel Boone, for
exceeds the
example,
resources.
we always max them out with utilities help, and our housing we're on wait lists. Our shelters are full. We don't have a lot of inpatient substance abuse options here in Clay County. So a lot of it's still lack of certain things, and then overwhelmed with what we do have.
Um, on the tool that I shared a couple of slides back, that might provide some additional resources as far as financial for the individual. And I saw several of the Medicare organizations provide support for utilities. So I'll share this PowerPoint so you can have some of those that may help with reaching out to Medicaid um, in order to get compensation. Um,
Thank you so much. That will be
Absolutely.
great.
Yep, I see lack of resources, lack of resources, lack of
And then
resources
I have a few that actually have private insurance, but they still obviously struggle, just because the economy
because of the
and stuff,
economy.
everything's been so high. Um, so I have some, like, if there's scholarship opportunities and stuff, we can,
When you say scholarship opportunities, tell me a little bit more about that, Tiffany.
like to cover medical costs like dental, vision, hearing, things of that need for the kids, especially dental. We have Elgin that helps us out a lot, but it can't meet the demand beyond like basic things. Like if they need a surgery, they have to go to a pediatric orthodontist and be referred, and it don't cover the cost of that. So any type of financial help for families that are a working household but still struggling but making too much to meet the needs of Medicare and stuff, and does that make sense what I'm saying? Like
Yeah, so
they're
they have,
poor, but it's like they're just on that cutoff, and it's still struggling to meet the needs of what they're trying to do for their kids.
yeah, the working poor. Okay. All right. Anyone else? For those individuals, do you have a fairly qualified health center in your community, Tiffany?
Yes, Kim Stevens is wonderful. She helps all she can, and she has other resources that she puts in touch with. We have food pantries, we have Christian Appalachian Project, we have a lot. But now vision is something we could definitely use. Hearing screening and stuff, and then of course dental. If we could like branch out a little more in dental, would be perfect. And then any
Mhm.
type of substance abuse, not prevention, but treatment for the households that already are struggling with the issues in the home would be a real game changer for our.
Okay. I think that's great. Um, Anyone else? I'm going to go to the next slide because this leads to our next question. How can Kentucky Rural Health Association help? I see somebody put vaccines. Tell me what you mean. You don't have providers in your community that are providing vaccines?
It
We've
looks like
talked about,
they
go on.
may have liked you responding, so maybe that's it. They don't have providers providing vaccines, I believe.
Mhm. From other areas of the state, are you seeing the same challenges that Tiffany talked about that she's experienced in Appalachia? Are you also seeing access to glasses, to dental services to be a concern? One of the things that I wanted to do by meeting with you guys today, and I'm in a new role as equity coordinator, is to understand where your equity challenges are. When we talk about vaccination and my former role with public health, I feel comfortable providing resources that support vaccination uptake in your communities. But I'd like to be able to do more. But I really want to understand how I can help. Sure, everybody needs more money in their budget, and that's great. But what type of services do you need in your community that you could refer someone to?
So I can speak. I was a coordinator about 3 years ago, so I don't know if it's still super relevant, but it might be. As a coordinator, we often found that vision screenings were an issue. Sometimes we would get referrals from teachers that would notice a child struggling, and we could set them up with our local Lions Club to get a vision screening and get them free glasses through them.
Mhm.
But that also includes follow-up from the parent in transportation to taking them to the appointment and so forth. So that just always seemed to be an ongoing thing. Also, we did have a local Walmart and we had a program called the Longest Day of Play that we would do at our local park. They would come and do free vision screenings at that program for us. But it was just specific to that Walmart that was willing to do it, I guess, because I've heard others say that theirs wouldn't do that. But that was an issue whenever I was a coordinator, vision screenings. I'm in the Boyd County area, by the way.
You're in the Floyd County area? Do we have anybody on here from Western Kentucky?
I'm Bowling Green.
Do you have the same challenges in Western Kentucky as Eastern Kentucky? Vision screenings, dental screenings, etc.
As far as Bowling Green, Warren County, we do, and lack of resources and all that. It's the same.
The same exact.
Yes.
Okay. Are you seeing it? You have a very large immigrant population. Are you seeing it consistently across to all populations, or is there need for resources for those that may not be Medicaid eligible?
For us, it's across the board, but more so for, we have some students that have recently come into the country. So, and they don't have any kind of insurance yet. So that is a need.
And then Cumberland Family has school-based clinics in all the schools in Bowling Green or Warren County.
Warren County.
Yeah, so having a federally qualified health center in the building, has that been helpful?
It is financially based, so not always.
So financially based,
If
if,
they can't make it, so if they don't have insurance, their payment is based on their income. But if one parent is like a migrant worker, the other parent's not working, some still can't afford whatever that bill may be. So it's not feasible for them.
okay. Okay, that's good to know. For those of you that work with organizations like our federally qualified health centers, do they have dental services they're providing or vision services? Or is it all referral out someplace else? Oh no, there are rural health clinics as well. They have a White House clinic that provides dental services. Okay, great.
I'm in Jefferson County, and we're fortunate to have the family health centers for families, but the dental locations are like the wait list is like they're not even taking new people. So that's not a resource right now for us.
Okay.
There's the U of L, but they're on a sliding scale, I believe. So yeah, there could definitely be more resources for dental.
Dental and vision.
Mhm.
Okay. Every insurance plan must have dental benefits. Every Medicaid insurance plan must have dental benefits. So if your children have Medicaid, then they should be able to go to the dentist. But Jesse, as I think about that, I see you're kind of writing things down. I think that we could talk with Medicaid to see if they needed oral surgery. What could that be covered under their medical benefits versus their dental benefits? And that's the way it's written on some plans. Okay. All right. Which the reason I bring that up, it would open up the doors to other providers. If they had Medicaid, then you could use the Medicaid dental benefit. They could bill Medicaid, and then you could use an oral surgery benefit on their medical plan, which may provide some additional opportunities. Warren County has a few dentists currently enrolling new patients with Medicaid. Okay. All right.
Another issue with some of mine goes back to that transportation when they're referred out, because the closest one that can perform what some of these kids are needing is like 45 minutes from us. And it's a wait list to get like LKLP or any other type of agency to arrange transport and make line.
Do you all have, does every county have Uber?
To my knowledge, Clay County doesn't.
Does not have, you don't have Uber
To my
drivers?
knowledge, I don't know that we do. I don't think we do.
Okay.
We do not. Jackson County.
Jackson, you don't have Uber drivers?
No.
Okay.
I think one of the issues that we have, I'm at a middle school, and
Mhm.
even after we have these issues identified, we have so many children living with grandparents or other relatives that there's just not the concern, the motivation to get these kids when they have to be referred out farther than just the home area.
Mhm.
We have like White House Clinic for dental. That dentist only here maybe 2 days a week, which it's hard to get an appointment. And then if they do see a dentist there and they refer them to Lexington or someplace farther out, that's an hour away. So the ball drops there.
Gotcha. I see people posting in the chat, but I don't have a chat button on my screen.
I can help you follow up with that.
Thank you, Beth.
Natasha Johnson said we have White House Clinic that provides dental services. Breda McMillan said Hardin County, they use Cumberland Healthy Kids Clinic Dental and the Kids Sight Lions Club for vision screenings. Richardsville FRC, Warren County has few dentists currently enrolling new patients with Medicaid. Teresa Ralston said we have found that there are very few dental providers that are taking state Medicaid. And Tiffany Whitaker said, I second that their needs don't get prioritized when they are in the home with extended family, and sometimes the grandparents aren't physically able to fully care for them as well.
Okay. Some of those things are fixable. I think about some of the incentives through Medicaid that, if you took a child for a visit, which provided some additional revenue in order to get them the further distance, that may be helpful. Also, there's resources to help pay for transportation. But if there isn't transportation, if there isn't a cab or a system, then the money for the transportation is a challenge. So I think that that's something that we need to continue to look at. We have about 15 minutes left, and I was going to share with you some resources on the Immunization Coalition, but since Jesse's here, Jesse, do you want to share those resources that are available in different languages?
Absolutely. So let me pull up my screen here and I can just share with you guys our website. Let's see. Okay. So for immunization resources, this is our website. It's immunizeki.org. And when you go here, you can go to the top and there's resources. So scroll down and you'll have vaccine flyers right here at the top. And I can share this out with you guys as well, so you guys can know exactly what I'm talking about. And these are all the vaccine flyers that we've had translated. So we have about 7 different languages that we offer in all of these vaccines. So we cover all these vaccines in English, Spanish, Arabic, Burmese, French, Swahili, and Haitian Creole. And you're able to just go in and download all of these PDFs. If you feel like that this is something you need, you can also just download one language depending on what you feel like is needed for your community. Down here, you can just download all of them in whatever language you're interested in. So along with that, we also have our vaccine forum. This forum was really developed for providers, for patients, for parents, for you guys to use to ask questions that you may have on childhood vaccines. So we partner with 10 providers across the state to give you guys trusted resources and answers. You'll just scroll through here and you'll create new posts. And from there, you can ask whatever question you want to like. You will have to create an account, but you can create it anonymously. So you can decide whatever username you want it to be. And that way, if you don't want anyone to know what question you're asking, or a parent wants to ask a question regarding their children, it's totally like I said, anonymous. You can go in, ask that question, and then you'll get notified when one of our providers has answered. And we really, really suggest using this. Like I said, I'll share out all of this information with you all, and I can also share out some flyers if you want to kind of give those to parents and share this information, because it could be a really big tool for you all.
One of the other things that Jesse's working on is having some of this information in a video. We know that in many populations, there's a low literacy level. And we've heard that from our providers across the state. My patients can't read. And so how do we provide that information to our patients in a manner that they can just listen to? And so that's coming soon, and we're excited about that. So we'll let you all know. In the meanwhile, what we'd like to do is take these opportunities that you've shared with us. What I hear over and over is resources, resources, resources. And of those resources, transportation is an opportunity, housing is an opportunity, dental and vision services are areas that you really need additional resources.
As well as substance use treatment centers. I have that as well.
And so we'd like to take this back and work with some of our partners in order to help find robust, sustainable solutions. Clearly, it's not going to happen overnight, and could take a little bit as we address some of these situations kind of one bite at a time. But we'll communicate really clearly with our MCOs, our Medicaid care organizations, to talk about what you're all seeing in the community and some challenges, to see if, as they develop their incentives for 2024, 2025, great, thanks for helping me pay for transportation, but I got no Uber. Doesn't help any. To see if there's some additional services that they can provide, and maybe increase rates of reimbursement for dentists, which would make caring for Medicaid patients more attractive, which would then open access. So we can have conversations about what we've talked about today with those MCOs, and then and see how it goes from there. You know, the leading cause of dementia in adults is hearing loss. And so we know that hearing impacts our ability to send and receive information and leads to isolation, depression, etc. It's no different with our pediatric or school-age population. We also know if you don't have good oral health, it makes it difficult to eat those healthy fruits and vegetables in order to grow and learn. And then the visual component is very, pretty obvious. Let me ask one question before we end our call today, and then open up for questions. If a child has a visual impairment and he has an individual education plan or an IEP, or maybe he has a 504 plan, can you write into that plan that glasses will be purchased for the child? Do you know? So then it would be covered by the school district versus if they didn't have Medicaid to cover glasses. I don't know the answer to that. I'm sure that many of you all are on IEP teams as you look at what's going on in your community. Erica, I see you came off on camera. Do you know any?
I don't know anything, but I'm currently, I have a family who has 4 students at our school. They have Medicaid. I've taken them, they don't have transportation, so I have taken them to the eye doctor 4 different times. Once to get their vision exam, because that was covered at that doctor's office. They didn't cover their glasses, so we went somewhere else. They fit them for glasses, and then come to find out they didn't cover their glasses. So then again, we went somewhere else, and we think that we finally got it covered, but they won't start the IEP process until he has glasses.
Really?
Been frustrating.
I don't know, we're not involved in writing IEPs. That, I know there's kind of a team that works to develop an individual education plan for students with a different impairment. You might consider, like, there's things on, once you get a prescription, you might consider like a Zenni, Zenni, or some of those online services. So I buy all my glasses there. And so these have bifocals with Invisalign, and they cost me $42. Frames, lens, Invisalign, and everything. So if they were able to get, for having an eye exam, get the money from Medicaid, that would give them the cash or the gift card that they could then use to purchase the glasses from the website. I mean, there are some frames and lenses that are like $10 or $15. That might be an option.
I'm sorry, I was helping a teacher. I wanted to say that here in Grant County, we have a program called Neediest Kids of All. I don't know if anyone else has that. And that program will help you purchase glasses for your students if you need them.
Is it statewide or is it just in Grant County?
I don't think it's just in Grant County, but I don't know if it's statewide. But it is something for everyone to look into.
Great suggestion.
Thank you.
Great suggestion.
It is called Neediest Kids of All. They have restrictions, but I know you can purchase classes through that program.
Perfect. All right. Well, I think that this has been a valuable time that we've spent together, understanding the resources that you need within your communities a little better, giving us some work to do as we work with rural care clinics, rural health clinics, FQHCs, for dental and vision, thinking outside the box about really taking some of these incentives that are given by the MCOs to pay for the next piece, right? So can you take your child to get the vaccine, or for a physical, and you get this incentive that would help pay for the oral care? I mean, can you begin to work at that? Developing a plan and sharing what you've shared with us back to the Medicaid organizations in order to see if they can, the incentives are great, the plans they have, but we've got some transportation issues, and we have some oral and visual care issues. And so can we really focus on them? And then also consider increasing Medicaid reimbursement, which would make care of the Medicaid insured child more attractive for our dentists. So I have Delta Dental insurance, and my insurance, my dentist doesn't accept my insurance because he says the rate of reimbursement is too low. So I think that, dental insurances are having challenges, across the state. So, but I think that those are good starting points. I am going to put my email address. Jesse, would you mind putting, since I don't have a chat, would you mind putting my email address in the chat box with yours? And please reach out if like, oh, I wish I had said, or hey, can you help with this? And we'd love to collaborate in order to improve the outcomes of our Kentuckians. Thank you for allowing to meet with you today. Beth, I'm gonna give it back to you. Jesse, do you want to say anything?
No, all I had to say was I just linked the Neediest Kids of All that you were talking about, Geneva. So if you all want to look into that, we'll also do our own research and be able to share that out with you all as well. And I dropped me and Dr. Harrington's email in the chat, so feel free to reach out to us.
Beth, I'll hand it over to you.
thank you all for speaking with us today, because I feel like we got a lot of information from this session, and it was nice to be able to give feedback and feel like, it's going to be taken back and implemented in some way. So thank you so much for allowing that opportunity. I'm going to put the exit survey link in the chat right now. You will get an hour of PD, as Quentin mentioned at the beginning of this call. I will give you the PD code in just a moment. But I wanted to let you, Amy and Jesse, know that in this exit survey, there's an opportunity for them to share their email address if they want more information, and I can share that back with you all as well. So I will connect you once we get those.
And I will email you my PowerPoint.
Okay, yes.
Which has those links embedded in it as well.
Perfect. And if you have any information you want to share with me that comes up, I can post it to the Frisk page as well and share out that way. So thank you guys so much. I think it was a great session. I hope everyone got a lot of information. I know I did.
Thank you. Thank you for allowing us to talk. And we'll all work together to make it a better, brighter day.
Love that.
Thank you.
I just put the approval code in the chat, and I will give you all a chance to get that completed.
Thank you,
Thank
guys.
you, Amy. Thank you, Jesse.
Thank you.
Bye.
Bye.